everybody. Welcome to Women's Health Tech Wednesday. Thank you so much for joining all of us. We are really excited today to be interviewing Amy West. I will take a second to just introduce myself first. I'm Andrea Diamond of Diamond Nutrition Counseling, LLC, and INC. And I'm working with HitLab to launch a very exciting new service, 100% telehealth nutrition counseling online by registered dietitians, and that's a little bit about me. Let me please introduce our guest today, who is Amy West from Novo Nordisk. She is the Senior Director, Patient Experience and Digital Health Innovation. And we are so excited to have you, Amy. Thank you for coming. And can you please give us a little bit of background on what you do?
Sure. Andrea, thank you. And thanks to the HitLab for having me today. My name's Amy West, and I've been in the pharma industry for over 25 years, primarily in the commercial space across a number of categories, including diabetes and metabolic disease, neuroscience, men's and women's health, as well as others. Always with a heavy focus on customer engagement and experience. Currently, I'm leading, we've actually had a sort of an organizational shift, and I'm now leading up the Novo Nordisk US Digital Transformation and Innovation team. So slightly different name and focus, but our focus in this new organization is that we are looking at longer term future horizon opportunities in healthcare, and how can we transform how people experience healthcare through disruptive innovation. And when I say people, I'm talking about patients, providers, payers, health systems, all the stakeholders in the healthcare ecosystem, because the experience ripples through all. And we really have to be thinking about how do we improve that. And so the team's approach is to start with the customer's problem to solve first. You're coming from pharma, we traditionally have a product or medication, and we're looking to figure out how do we position it with the audience, which is important. But my team, because we're very future focused, we're really trying to understand the customer's problem to solve first, and how do we find the right solution. We put ourselves in their shoes and understand their problems and pain points first. And then we apply an agile experimentation process to identify new novel opportunities and solutions for the future that will deliver, a shared value for the customer, but then also for the business. And I just want to add too that I personally am very passionate about the patient side when we talk about healthcare. Because I'm one myself, along with my family and friends. And I really strongly believe that getting access to pharmacotherapy and traditional health interventions is obviously critical, but medication alone isn't enough. And sometimes it can be hard to get access to coordinated care, especially as what we've seen with the COVID situation. And that's why I love working in the digital and technology space, because this area of innovation can enable us to go beyond this theoretical pill and deliver experiences that are going to positively influence a person's understanding, behavior, engagement, and ability to make the right decisions for themselves in a personalized and relevant way that works for them. And digital innovation gives us the opportunity to better understand the patients as people first, and use technology to enable a more individualized and relevant solution or support or intervention along with medication to achieve a better quality of life and improved outcome. Those things have to work together. The traditional medication and pharmacotherapy and interventions with that experience and that human touch. And that's again why I find this space so fascinating.
Fabulous, fabulous. Thank you. You and I spoke briefly, and you spoke to the need actually for a cultural shift in this space. And that is one of the larger themes I understood that you are working with. Can you speak to that a little bit?
Sure. Yeah. And I think it really kind of ties back to that idea of marrying the science with the human behavior. We've seen in healthcare this rise in consumerism, and when we look across many industries, whether it's financial services or retail or travel and leisure, technology has really come in and taken over in many aspects, and given the consumer more control of that experience. And we haven't really had that in healthcare because of the institutions and the legacy systems and the way it traditionally works. But again, with this rise in consumerism in these other industries, there is an expectation that they have a better experience in the healthcare arena as well. So that's really pushing us in the healthcare space to change the way we do things and to think about how we engage with our customers differently. And that requires a culture shift, because it's not just about positioning a medication or a specific episodic solution to the individual and expecting them to just either embrace it or, this is all you have. So to change the way we approach the customer, we have to change our mindsets and our culture in how we engage the customer. And it really comes down to that experience. How do we cater to the individual based on how, when, and the context of how they want to engage, and how do we be there for them based on what they desire? And that, again, is going to require us to kind of, expand or augment our science hat, which is at the core of our business, but pull it through and expand it into the human being, the holistic patient need. How is the patient as a person? How are you living your life every single day, so that we can better, give you the right solutions and engage you and support you. That marriage of science and sort of human nature, it's a different approach for the pharmaceutical industry. And so we have to evolve our ways of approaching the problem differently. We have to adjust our solutioning process differently. And there are tools that we can use to support that mindset and culture shift. So things like empathy training, design thinking methodologies, apply those different tools and resources to the way we approach our business that can help change and mold our opportunities to find the right interventions. And it's important as well that as you are, doing this, or you're taking this sort of different approach to the customer, that it is supported at all levels of the organization. It really, in some ways, it has to start from the top and be champion and need advocacy from the top of the organization. And it has to trickle up and down throughout in order to really build this culture shift and build that muscle throughout the entire organization.
So fascinating and so progressive for the pharma industry. So it's very exciting. And the idea of a cultural shift within the organization seems to me one of the shifts, and the other shift is really your relationship with that patient, which is a cultural shift outside of the organization in collaboration with the patient, which is another type of cultural shift, which is really exciting and really empowering to a patient. I think that you're really looking to shift the perspective, the way a patient perceives pharma. And yeah, please.
Well, I was just going to say, we're really, obviously, at Novo Nordisk, we are all about really, our mission and vision in some ways is to put ourselves out of business. If we can find a cure for these diseases, that would be the best of all worlds, right? And maybe not for the business, but obviously it's going to have a huge impact on the health and wellness of the population. But we're looking, how can we, until that time, continue to innovate in the pharmacotherapy space, but also how do we improve that experience and make it easier for the person to engage? And so we really are trying to take that holistic person-centric experience approach, because the data shows that for the average person who is struggling with chronic health conditions or having to manage it on a daily basis, only 20% of what influences the health of the person is related to the access and quality of the health care. The other 80% of influencers are found in everyday living. It's the behaviors, the social determinants of health, the socioeconomic factors, the environment in which you live. Do you live in a safe neighborhood? Do you live in an area of high crime? Do you have access to healthy food? Do you have access to transportation? These are all things that could be getting in the way of or enabling, engagement in healthcare. And traditionally in the pharmaceutical manufacturing space, we haven't looked at those things, and we haven't considered those broader social implications. And so that's the approach that Novo Nordisk, we're very, very focused on, really understanding and engaging the patient as a person, so that we can support you in a better way to have a better, better access to or better experience with the medication or whatever that healthcare intervention is.
Fabulous, fabulous. It really is a tectonic shift, it feels like. And I think that the perspective of a patient is that there isn't really very much communication, if at all, beyond their medication with the pharma companies. So this is so welcome and so timely, because I know that the shift in healthcare altogether is patient-centric, as you noted. So being a part of that, the timeliness of this is really exciting.
And I don't, just to add to that too, I think it's I think we all have to kind of hold the mirror up a little bit too, because we all have said for a long time we're patient-centric. And I believe at the core, our organizations, we're there for the patient. But is our approach truly patient-centric? I mean, you really have to ask yourself, and many, I see many scenarios, across the industry where I see a solution out there, but is the solution really about how do I sell more of my product based on the needs of the business, versus how am I really connecting with the individual and helping them integrate it into their life, or make it easier for them to take, get access to, or use in a way, and then also see the benefit of it. Really, really understand that there's a benefit there, and that they, support that self-management and self-engagement. And that's just, again, the kind of thing that I think we all have to kind of take a step back at times and really ask ourselves, yes, we're patient-centric, but are we really acting, are we really behaving that way? And that's a huge opportunity, as well as a challenge.
Absolutely, absolutely. So I'm interested to know, curious to know how this idea is received. How is it being received within the industry, within your company?
Sure. I mean, it's very positive, and I think it all makes sense on paper, or in a strategy document, and it's really, again, what we should be doing anyway. But doing it is really hard, because you've got a lot of, in large corporations, you've got a lot of different business units, and you have different sort of remits or objectives. Some are nearer term, some are longer term. And how do you align objectives to ensure that that holistic patient foundation is embedded in everything that you're doing? And so it's really about creating that red thread across the organization, whether it's a commercial arm or medical arm or a market access arm, or your insights and your infrastructure. What is the infrastructure that you have to support the ability to reach patients and engage them? So it's a complicated, it's very complex. The notion is very simple, but to make it happen is really hard at times, especially when you also have, as a commercial organization, you have business objectives, you have your certain volumes that you have to reach and things like that, and sometimes some of those obvious things get lost as you're really trying to focus on your business objectives. So you just have to make sure that you're holding yourself accountable. The other piece of it too is that as you're thinking about some of these opportunities, apply a framework that enables agility and the ability to take risks in a strategic way, that you're not going to break the bank if something doesn't work well. You need sort of that fail fast, test, learn, incubate type of framework that allows you to try, take different approaches to supporting the needs of your customer that you might not have traditionally done, that haven't, by the playbook proven out in the past. How do we create these new opportunities? And the way to do that really is, again, to apply that, quick test and learn sort of incubation process that allows you to determine in a rapid type of way what does seem to hold value, that desirability, feasibility, viability factor that could potentially get scaled, versus those things that are going to fall out because they're not meeting the criteria that you need to meet in order to have a viable solution.
It certainly sounds complex. And as you mentioned the word infrastructure, I imagine there are many moving parts here, and that can be a very new kind of platform to create in many ways, to deliver what your hope is to deliver.
Yeah, I mean, obviously data is at the core of technology and data, technology and digital. And there's so much opportunity there, and data is really what is going to make the big difference. And it's, the traditional pharma company, we have the clinical data sets, we have the traditional biomarkers that are used as standard of care, whether it's a BMI or a blood sugar reading if you're talking about diabetes. But we don't really understand those broader data sets about the social aspects of the individual, or some of those things that really create that portrait of who the person is. And so we've got to try to be better about capturing broader data sets in that way. There are challenges with that based on the entity that you are, around how you can use data, what you can capture, how you can commingle it. But we're working through that, obviously, from data privacy and regulatory standpoint. But it really is going to come down to how can we better understand our customers through real world, real time information, not the historic data point, biomarker data points that we have. It's really got to be more real time. How do you create the infrastructure that can capture that and create a way that it's usable? And from there, if you can start to build that infrastructure, that's when you can start to apply the more sophisticated computations that technology that you have with AI, machine learning, and predictive algorithms, because that's going to be a huge opportunity as well when we think about better identifying who are the right people to connect our solutions to, in light of who you are, where you live, what your sort of clinical and social biomarkers are.
Absolutely. Very progressive, very exciting. I personally do not have any further questions for you. Would you like to speak to anything that I haven't touched on?
Yeah, I mean, I think, again, the real core for me is, I think in the healthcare arena, whether you're a pharmaceutical manufacturer or you're, working for a health system or a pharmacy, or you're a provider, it's just so critically important to engage with the quote unquote patient as a person. People don't identify as patients. They don't identify as somebody with cardiovascular disease. They identify as being, a single mom with 3 kids trying to homeschool, during a pandemic and manage 2 jobs to keep, food on the table and a roof over their head. And that's what we have to really, really be connected to when we think about healthcare, and being able to deliver, solutions and interventions that are going to really be the right thing for the individual. and help them help themselves and have, better quality of life and better outcomes.
Fantastic, fantastic. It's just so, again, refreshing and exciting for me to hear it coming from Big Pharma. And I really applaud you for your innovation and direction.
Well, as I said, that's very much has to be spearheaded by the top as well. So we've got great leaders and visionaries that are very supportive of that, and they truly believe that, we our future is embedded in how well we can help people that have health issues.
Fantastic, beautiful. Thank you so much. And at this point, I'd like to open it up to questions and from the audience. Does anybody have any questions?
I have to say, I love the real world backgrounds that we have.
Yes.
You got your fitness machine. It's great.
Let me just see here if I have any. Okay. Okay, so one question here is, would we like to speak about mental health during the pandemic?
Absolutely. I mean, I think we all struggle a little with our mental health during this whole pandemic, with all the sort of the new ways of working, the new ways of living in light of this. I have to say, I'm not an expert in the mental health space. That's not really my current focus. But again, I think based on what I was saying earlier, anybody that's dealing with chronic health challenges, whether it's mental health or physical health issues, we have to be able to find interventions and solutions that are going to meet the individual where they are and when they need us to be there and in the right context. It has to be as individualized and personalized as possible. And I think that, unfortunately, with the focus on COVID-19 and people having to be treated very specifically for that very acute situation, after things start to normalize and open up, once the herd immunity and vaccines are out there, I think we're going to continue to see a rise in some of these mental health challenges because they haven't been able to be addressed. They've taken a back burner to some of the acute situations that we've seen, and I'm sure we'll see this with some other disease states as well. But it's an area of challenge. But I also think that during the pandemic, we've seen a bit of a tide shift in that the stigma of having some of the mental health challenges has become less and less, and we are seeing the opportunity for technology and digital to support through Talkspace and telehealth coaching, ways to intervene that don't require you to actually go into a doctor's office or a psychiatrist or psychologist office to have a conversation or to get some of the help that you need. So from a digital and tech standpoint, I can definitely see where there's a huge opportunity to support people in the mental health space.
Wonderful, thank you. One of my concerns is reaching those people who may not be as tech savvy and be able to afford or even are aware of the wearables and all of the things coming into the digital space or that are in the digital space at this time. How do we reach those? So those are some of the most vulnerable populations, and that's really probably a whole different conversation. But it's certainly a concern, and I know that one of the thrust today is equal access, of course. And so those are challenges that remain to be seen. So one question came about here, whether I might speak to better meeting the patient where they are in the nutrition space. That is certainly something that we in my business are doing at this time, and we offer private counseling and classes, and we are actually working very diligently with this idea of people who do not have equal access, but who may even at least have a computer, or know somebody who does have a computer, and so on, to get groups together and maybe approaching it as a group group issues, and especially related to COVID and other kinds of things where people can have equal access and they don't necessarily have to have.
And how can we make that a part of the broader support? Because I think many people, we could all use, better guidance with our nutrition, and so much of nutrition factors in on things like mental health as well as other, disease states and things like that. So how do we make that from that holistic patient portrait standpoint? How do we include nutrition as a fundamental component of a broader set of tools and resources that people have? And again, do it in a way that people that might not have the access to all the technology, can get it. The nice thing is most people do have some type of mobile phone. Might not be a smartphone, but there is a way to do that remote counseling or contact.
Yes.
For many people, and it does support, people in rural areas or suburban areas, so
Yes.
That's a nice step in that direction.
Yes, absolutely. Absolutely. And there's a lot fundamentally, of course, as you said, and the partnering really of the different modalities, of course, like you said, the broader picture to bring in all aspects. So yes, very good. Any other questions? Okay. What I'd like to do is invite you to become an active part of Women's Health Tech and HIT Lab. They have been instrumental for me as far as a top-notch team in creating, and we're hopefully about to launch a wonderful new platform in nutrition, and just a superb team. So I invite you to stay in touch. And thank you for attending today. Thank you, Amy. This was most interesting and insightful. And I wish you well in all that you do.
Same to you. And thank you to the HIT Lab team as well. It was a great opportunity, and I appreciated the chance to share.
Wonderful. Thank you. Thank you.
Take care. Stay well. Bye.
Bye.